Good morning and Happy New Year. My name is Waqas Khan. I'm actually going to talk about briefly about the use of aspirin as a preventive therapy in general patient population. So there are two types of preventive therapies. One is primary prevention, one is secondary prevention, and second one is secondary prevention. What is the difference between those two type of preventions? Our primary prevention is where you don't have any history of cardiovascular disease or stroke history, versus secondary prevention is where you actually have the disease already present or documented, and in those situations, and I will talk briefly about the use of aspirin in those individuals. So primary prevention, I just want to briefly touch base with that in terms of use of aspirin in a certain age group, because a lot of people are using the aspirin, and we are kind of shying away from using aspirin in a certain age group, and those are particularly age 70 or above, because those individuals are very high risk for bleeding with the use of aspirin, and we generally do not recommend using aspirin based on different guidelines from American College of Cardiology or American Heart Association or United States Preventive Task Force guidelines. They all support against using use of aspirin in age 70 or above as a primary preventive therapy. Also, younger individuals below 40 in different guidelines, or 50, we also do not we don't use aspirin as a primary preventive therapy. However, ages of 50 to 59 or 60 to 69, those two age groups where if they are high risk for cardiovascular events, we recommend using aspirin in those individuals. Also, at the same time, there should not be high risk of bleeding in those individuals. And secondary prevention is where you have secondary prevention is where you actually have documented coronary artery disease or stroke or some peripheral vascular disease. In those individuals, we recommend using aspirin, again considering the bleeding risk. So the bottom line or the message in this particular video we want to give is that patients who are ages 70 or above and they have no cardiovascular disease, or they are not high risk for cardiovascular, generally they are not people who are 70 or above, we recommend not using aspirin as a primary prevention, and also in younger individuals we don't want to use the aspirin as a primary prevention, and younger individuals mean generally below 50 years of age. So thank you very much.